Okay, is everybody ready if we make a start? Okay, so thank you, good morning, and welcome to today's meeting of the Health and Wellbeing Board. First item is any apologies and substitutes. I've got apologies which probably haven't been passed on from Councillor Wilkinson and Councillor Megan Swift. Have we any other apologies?
Yeah, Councillor Metcalfe and Sarah Baker, Chief Superintendent, apologised.
Okay, thank you. Okay, item 2, if I could remind members to declare any interests you may have in items as they arise. And item 3, there's no items for which we wish to exclude the public, so all the items are being taken live. Item 4 is minutes of the meeting held on the 28th of January. Can I check, are people happy that these are a correct record? I'm not seeing any amendments, so I will take those as correct. Thank you. Item 5, question time. Have we been sent any questions?
Questions received, Chair.
That's fine, thank you. So, item 6, COVID impact update. So the covering reports from Mike. Mike, do you want to add anything to this? You're on mute.
No, Chair. No, nothing. I've got nothing to add to it. I think I was just the name on the report.
Okay. So, anybody want to expand on current issues, or anybody have any questions or comments? I mean, inevitably, things have undoubtedly changed since the report was written, because life's like that, isn't it? So, I don't know whether, Debs, you want to give a quick headlines?
Yeah, I just wondered, Chair, if it's worth just bringing it just slightly more up to date, obviously, than when the paper was written. Just to say that the infection rate has continued to reduce, and particularly we've seen quite a large reduction when following cases associated with a large workplace outbreak, leaving our 7-day figures. So the rate as of I'm trying to remember the days, I think up to the 26th of February was actually 118 per 100,000. So that's quite a reduction from what's included in the paper. And just, Chair, just to say that we are in the process of, in light of the roadmap and the lifting of restrictions, we are in the process of updating our local outbreak plan, which we will have done in the next few weeks, and you know, it may well be that obviously partners on the Health and Wellbeing Board will be contributing to that update as well. And I suppose the final sort of thing to mention is that it is becoming, or it has become clear to us that you know, we can expect, I think, to have enduring areas where we have enduring infection rates for COVID, based on our experiences of coming out of previous lockdowns, and that we're really quite clear now that that's due to a combination of the nature of our economy, deprivation, and particularly larger household sizes in people that need to continue to go out to work during lockdowns, and for whom it's harder for them to work from home. But so I think our plan will really set out the action that we'll be taking to address that moving forward as restrictions are relaxed.
Thanks very much, Debs. Neil, is there anything to add in terms of the vaccination programme?
I think just to sort of confirm the positive news that's in the report, I think since the report was authored, a lot of our percentages have increased. So in the top 4 cohorts, we're all in the 90% coverage for all of those now, which is good. And we're working down into cohorts 5 and 6. There's a bit of a delay with vaccine supply. However, from the 15th of March, we are getting significant increases, and across West Yorkshire, we're going to get about 180,000 a week. that might increase in April as well as the Moderna vaccine comes online as well. So we're looking to be doing between 10 and 15,000 vaccinations a week in Calderdale with our existing providers. And NHS England have just done a new, I suppose, expressions of interest for community pharmacy. So we've had 21 expressions of interest from community pharmacy to be involved. Unfortunately, quite a lot of those are as mass vaccination sites rather than some of the small sort of 400 doses that we were expecting. So we're just sort of working through those to supplement our current GP and sort of community pharmacy offerings over the next sort of few weeks. So everything progressing well. Lots of invites going out to the new age groups, and also we've done a lot of work with social care and the voluntary sector around carers, paid and unpaid. And we've got arrangements in place to put them through CHFT and Boots. And we're also doing that with some other sort of demographic sort of profiles as well. We've done some work through our JCVI group to sort of work with taxi drivers, and we've got them booked in the next few weeks with Boots as well. So all going really well, hoping to improve our capacity as we get more vaccine and on target to achieve and exceed targets.
Thanks very much, Neil. Robin?
Yeah, I think we haven't actually met formally since we reached the target on the 15th of February. So I think just to thank everyone in the whole of the system in Calderdale for an incredible effort to ensure that all of the 4 priority groups were offered the vaccine by that date, and the top 4 groups. We are now seeing a steady improvement in the variation, I think, of vaccine uptake, which is clearly still a significant issue, and that's really positive. So we do see some differentiation between levels of uptake for all sorts of reasons, but we are seeing that improve. And we're also seeing that moving into the priority 6 group, I think those with underlying health conditions, is a significant population, and I think we've made really good progress on that. We're heading over, we're looking to be at the point where we're getting better data, and we'll be looking to publish some of that data. And I know that last week we put out, back when we reached around 56,000, I think it's going to increase since then. I also just want to make a point about the thanks to the progress we've made around carers. It's quite a complex category, actually, to get that right, to ensure that you are reaching all the carers. We've got nearly 20,000 carers in Calderdale. That's a significant number. There's a lot of progress being made on that group, and clearly that's really important in terms of reducing risk and protecting those that are often special, and that includes unpaid carers as well. So we just progress on that. Just to pick up a couple other points about the next few weeks, that we are clearly seeing stage 1 of the roadmap begin on the 8th of March with schools opening. We're working intensively with schools, as I know Julie would testify. There are all sorts of challenges around testing, capacity, impacts on if we need some of it, I think even more challenging now. And just to note that, we're doing a lot of work to scale up testing of those that need to work. So just to sort of highlight the fact that people have availability across all our sectors, including private employers whose staff do need to actually attend work. And what we know is that workplaces are a really key element to this. So when we've had a challenge in recent weeks, it has been workplace related. And I think the other thing just to say from a sort of local resilience forum perspective is that sort of nationally, there are 3 big areas of focus as we move through the roadmap in terms of managing the risk. One of them is variants, and you'll see a lot of coverage around that. Fortunately, we haven't had in Calderdale a need to implement surge testing, but clearly that is a risk that we're monitoring. Secondly is vaccine uptake and ensuring we're reaching the vaccine impact. But thirdly also is just some areas do have enduring transmission, and West Yorkshire is one of them, and we are seeing ourselves relatively, although our levels are going in a good direction and continue to reduce, relatively speaking, our levels are now higher if you look at us at a national level than where we were in the peak. And that's very much a replication of the previous phases of this pandemic. And just to be mindful that 29th of March, which I don't think we'll meeting again before that date, is when there will be potentially a lot more people out and about, where some of those requirements around social contact will change. The rule of 6 will come back in. And clearly we'll be going into Easter, and that's really positive for people to be able to do that. But obviously also you'll have a lot of facilities that are closed still at that point. So it will be a risky time for us. So I would just emphasise the point about everyone working with the restrictions, supporting the messages, and we're not through this yet. Thank you, Chair.
Thanks very much, Robin. Are there any other partners that want to update? Oh, Ashley, you want to ask a question? Yeah.
Thank you, Chair. Yes, I'm sorry I arrived a little bit late. I had trouble with the connection. The question I was going to ask, and it may have been covered because I was a little late, was that Debs very kindly came to the Wallywood Forum the other night, and one of the items she raised was that of the uptake of vaccination and the differentiation between different parts of our ward, and I guess in other parts of the borough as well, in that the BAME community has a much lower uptake, I think in the order of 70% as opposed to 90+%. And obviously that's a worrying aspect of this whole process. And I wonder what we in general, as members of this board, would be able to do about helping those two figures come closer together. Thank you.
Thanks, Ashley. Debs, can I bring you back on that one?
Yeah, thanks, Chair. And I think just to be really clear, we do have some evidence of variation across the patch, but I think it's really important that we're clear that even in the area with the lowest uptake, which is an area with a large Black, Asian, minority ethnic population, well over 3/4 of people have had the vaccine. So it's really important that we understand that. But yeah, what we've seen is some fantastic improvement in those areas of the borough where we had lowest uptake 3 weeks ago. We've now, it was under 60%, and we're now up to 77% uptake in people that are eligible. And the things that we've done there, and I did want to come in actually and just really celebrate and recognise the amazing work of the Central Primary Care Network and Dr. Akhtar and his team there, because they've made a superhuman effort to really engage with communities through the link workers, through delivering pop-up clinic at the mosque, through having conversations with people who haven't yet taken up the offer that have been eligible, and listen to concerns. And we've really seen, I mean, that's a massive improvement in 3 weeks, between less than 60% in the lowest area to 77%. And then what I would also say is one of those middle layer super output areas that used to be in the bottom 2 is now sort of mid-table in middle layer super output areas. It's actually gone up the rankings. And so just, I think it's really important, and Councillor it makes a really, really important point, and we will continue, I think, working with our colleagues in the primary care networks, and we're going to be running a pop-up vaccination clinic, aren't we, Neil, in the Elland Mosque this weekend, which is great news. So I think we'll carry on keeping the real strong focus on that. But I think we found some of the things that work, Councillor Evans, now, by the improvement that we've already seen. And so yeah, just real massive recognition for the work of Central Primary Care Network, who've done a sterling job.
Thanks very much, Debs. Julie, you touched on some of the challenges for children's services in your report. Do you want to add anything to that briefly?
I do, Councillor Swift. I think this is one of the examples of how quickly things can change in terms of morale and how people are feeling. I think the rollout of the vaccine, the percentage of over 70s that have been done in the borough, the social workers have been vaccinated, the kind of light at the end of the tunnel in terms of the national roadmap has really helped lift people's spirits. And a lot of the health and care leaders and yourself know we did have our annual conversation with Ofsted last week that was really positive. We meet with them once a year, and their overview of how the services kept core business going despite COVID, and the kind of innovation and creativity has really boosted morale. So we know from a kind of check-in with staff this week, things have actually started to be a lot more positive. So I think, you know, a couple of weeks ago, I think it's just part of the roller coaster of COVID, how people feel, but people are feeling a lot better and can see, you know, the kind of progress that's being made, you know, that we've just been talking about, which is fabulous. So yeah, I would say morale's a lot better actually in the children's social care teams. As Robin said, the schools are getting very much ready for Monday. A key point to get, you know, children, young people in tested, particularly in secondary, to have a couple of those tests in school to make sure they can do the test correctly. Then they'll be able to do it at home before they come in. So it's a bit of a tricky time next week for schools, because they don't know what they're going to get when children come in and they have that first test, but very committed to getting children back into education very much from Monday, Councillor Swift and Health and Wellbeing Board members.
Thanks. So can I just ask on that in terms of schools, with both the testing and the mask wearing in schools, the government have said that it's kind of strongly recommended but not mandatory, and I just wondered how you know, if you had any sort of feel for how secondary schools are going to manage that in practice.
I think in the main, most young people, and, you know, it won't be an issue for the staff, but most young people will adhere to it. I think we have got a couple of indications from some of the secondary schools that have already been contacted saying parents are not going to agree to a small handful of children being tested, and they're not going to agree to them wearing masks either. And that'll be looked at, you know, within an individual basis by the school, depending how much space they've got. It's all about social distancing. These are extra measures, particularly around the mask wearing, where social distancing cannot be put into place. So we're working with the heads on it. I think in the main people will adhere to it. It is mandatory that children go back to school. So we'll be looking at every situation uniquely and individually with the school and the parents, and looking about what's happening around attendance and mask wearing. So a small handful, but I don't think it will be a major problem.
Thanks, Julie. Any other partners want to add to their reports? I don't know, Anna or Tim. Oh, Neil, sorry, are you indicating?
So I just wanted to.
Sorry, yeah, okay. Tim first, then Neil. Okay.
Yeah, there's nothing major I'd want to highlight over and above the report, other than to say I think some of the things have been covered a little earlier. And by the way, apologies for not being able to join appropriately. I've had some challenges here this morning. I would just say reinforce the point that I think was being made earlier about all the work that's been done in terms of the vaccination programme, and the importance of the approach that we take in supporting people who are hesitant, and ensuring that we don't think it's a sort of a one-off offer, and keeping the door open we've found has been particularly helpful. We've also found the question and answer sessions that we run on a regular basis being particularly helpful. And again, I think the more that we can do in terms of those sort of conversations, the more chance we have of rectifying some of those inequalities that we're seeing out there at the moment. And I think that's really where a big part of our time has to be spent, and I know that's common for everybody. The other thing I would just stress is about the fact that just in like what Julie said, there's no doubt that morale is improving amongst our staff and the people that we support as a result of the roadmap. But I think we ought to be mindful of the fact that that also brings some challenges to people in terms of their views around how they should be approaching some of the current measures. So we might see people perhaps being a little less keen to wear masks or keep the social distance on the basis that they've had their first vaccination, and feel that the second one may not be far away, and therefore after that things will all be okay and they know to go back to normal. So I think I sort of I've certainly done note to self, and we're certainly working on that within our organisation to make sure we have the right messaging and keep that high profile around the risks of transmission, and working with colleagues, friends, family, etc. So just those points I'd like to make. Thanks, Chair.
Thanks very much, Tim. Neil?
Thanks to hopefully sort of cover a few of the bits that have sort of been raised. So we're currently working on an inequalities sort of plan. So throughout the vaccination programme, we've had that at the head of everything we've done. It's clearly something we haven't forgotten about in Calderdale at all. So we're doing works with the mosques. We're also doing work with our PCNs to ensure that we have some specialist LD clinics as well, recognising those that need help and those that are vulnerable to go into clinics and outside of the main sites that we've got now. So we're doing the plan on all inequalities, not just BAME take up, as we recognise we've got them across the borough for various things. We're also working with CHFT and the GPs to have some allergy and reaction clinics as well for those that have had reactions to the first, and also those that have got allergies that are preventing them as well, so that we can do that in a secure place as well. And I think the message that we're putting out to all partners is that it's not a one-offer once. So particularly with social care and healthcare workers, we continually push the message out and provide availability for them to be vaccinated. And we're seeing those rates to continually increase. And a number of our GPs have done some work in care homes where they've spoken to staff and reassured them, and we've seen an increase in that uptake. So it's definitely not a one offer and you're sort of struck off. We do have a continual second chance for people to change their mind and be catch up, and that's very key in all the messaging that we're putting out to all partners.
Got the muting wrong. Thank you. Anna, do you want to add anything from the Trust's point of view at the moment?
Yes, thank you very much. In keeping with the trend, the numbers are reducing, the number of inpatients in hospital with COVID, but we are needing to continue to maintain a separation of areas for COVID and non-COVID patients. So there is a continuation of the need for us to deploy staffing into additional areas. So whilst things are improving, there are still some capacity challenges regarding the use of our facilities and the deployment of our staff, but they are definitely improving. Throughout the pandemic, we've maintained good access to cancer treatments, and our attention is really now focused around how we move forward around the recovery programme and being able to provide treatment for those patients that have had their care delayed due to the pandemic. We're paying particular focus to make sure that, as well as looking at prioritisation of patients based on their clinical need for treatment, that we're also using real data regarding inequalities, index of multiple deprivation, other protected characteristics. So we ensure that through the recovery phase, we're not widening inequalities and that we're very sighted on that. The other real focus for us has been around the vaccination programme for staff and carers and partners across the system. We've delivered 26,000 doses, and that represents 79% of our workforce is included within that have had first dose. And we have this week commenced the distribute the dosing for second dose. So I think those are the main points that I just highlight from our report.
Thank you. Caroline, did I miss? I'm sorry, I might have missed you earlier. I apologise. Do you still want to
Neil actually covered it. I was just going to point out the bespoke learning disability clinics that we're designing, but also to perhaps pick up and further that we're also doing something similar, following on from that for the serious mental illness patients. So yeah, just to highlight that.
That's great. Thank you. Ian, do you want to add anything on the adult care side?
I think the only thing I probably would add is, of course, the announcement around the roadmap also indicated that there would be a reintroduction of care home visiting on the 8th of March. It was very different to the announcement that had been on the 2nd of December. So we've been working with our care home providers to get ready for allowing a single consistent visitor that with the use of PPE, they would be allowed to have a visit that was face-to-face without screens. It wouldn't necessarily enable people to hug and to kiss, and contact is discouraged, but actually technically the guidance has actually slightly disappeared this week, but we were assured it will come back before the 8th, that they would be able to hold hands with appropriate PPE in place. Obviously, I think for both residents, relatives and care homes, I think they're really keen to work towards this. And I think the uptake in both care homes and care home staff is going to be very supportive of this. So we're working with homes over the last week or so to kind of prepare for that. We've got a final meeting with register managers today just to make sure. The only challenge will be where we are still experiencing some outbreaks in some of our homes, as you'll see from the report, that's slightly out of date, but we've currently got 6 homes, and whilst they're in outbreak, as would be in normal practice, visiting would not be permitted in that period. So there may be a delay in some homes being able to comply with that requirement, but we'll be working towards it.
But just for clarity, I assume again that would be consistent with the guidance anyway, not to have visiting ones now.
Yes, yeah.
So I think it's quite helpful to mention that, because it has been, obviously there's quite a lot of attention to it, and there was something shared on, I've seen the odd thing shared on social media suggesting that Calderdale wasn't planning to go along with the guidance. So it's important to emphasise that's not the case, and we're working along with the national guidance.
We very clearly are. And I think the other point is, of course, that this is the current guidance from the 8th of March. We will be working with all stakeholders to think about what that might look like once we get past June in terms of the broader opening up requirements. So it's not a single step path. There are several steps that we'll be able to look towards to gradually increasing access to care home visiting.
Thank you. Okay, Sue, you made a comment, passed on some thanks in the chat, which has been picked up. So I don't know if you want to come in and add to that as well. But I will just say to people, I have got everybody on one screen, but I am missing the odd hand. So if I do miss anyone, if people put a comment in chat as well, I have got that open, so I'll see that there. Is there anybody else I've missed or wants to add anything to what we've heard? I think that's been a really helpful update generally, which I'd summarise as great progress. And again, add my thanks to those that have been said for everybody who's working on the vaccinations. Really important targeted works on people who are hesitant and on areas where take-up's lower, and that the results of that are starting to look really positive. But clearly important messages to people out there about continuing to follow the guidance about social distancing, and concerns about mixed messaging as we start to move out of onto the next stages of the roadmap. But thank you everyone for that, and that's been a really helpful update, I think. I'll move us on, if that's okay, then to item 7, health and wellbeing strategy, dental decay age 5. And I think, Julie, are you introducing this? Lost you, yeah.
Will do, Councillor Swift, and Debs may want to come in. And just to clarify, this is from Public Health England data. And you can see it's quite a remarkable, it's a remarkable improvement, which is really good around dental health for children in the borough. I think when you look at the section about what is data telling us, it is pretty shocking that it is the biggest cause of hospital admissions is dental decay. It gets to the point when children are in pain. So it's really good to see this improvement, and it measures 5-year-olds with dental decay. And what we've seen is it's fallen from the 40% to the 26.7%. And I think this report sets out some of the really kind of bespoke work that's happened with deprived communities, reducing those health inequalities, working across both Calderdale and Kirklees, but getting in early around breastfeeding, that we know if mums breastfeed, the dental health of their babies is likely to be better than if you don't. And just looking at some of that real targeted work around the most deprived communities, around regular brushing, has really made a huge difference. So you can also see in there's been a focus on Gypsy, Roma and traveller families as well. So I think this is a really good example of trying to tackle health inequalities across the population. So I'll just pause there just to see if there's anything that Debs would like to add to the main report before we go into questions, Councillor Swift.
Thank you. Debs?
But really, just to add to what Julie said, the success is really about embedding oral health into things like early years settings through our health visiting services. So it's really about sort of integrating it into the way that we engage with families, in the early years, and that's really, really important. And we know that getting fluoride onto children's teeth as they are emerging out of their gums in those early days is the most important thing that we can do, and it's great to see that being delivered right across a number of early years settings, and particularly in children's centres, and as I say, through health visiting.
Thanks, Debs. This item was just reminding me that I should at the start made reference to the sad death of Councillor Marilyn Greenwood, who was a member of this board in the past, and of course, and I think more recently through scrutiny, has taken quite an interest in issues around oral health. So I know would have wanted to make some comments about this. I know a number of members of the panel at the time did pass on their sympathies to Councillor Greenwood's family, but I would just like to minute that as well. Perhaps I should have said that at the introductory remarks, and apologies. So, are there any questions or comments on the issue here and the work that's being undertaken? Yes, Stephen.
Thanks, Leader. Yeah, I just I know quite a few years ago, both you and I were just about the only councillors willing to back fluoride in the water, which I'm still convinced is the correct way forward, so that all children can have that protection. And I just wondered if it's worth floating that again to see whether minds have changed.
I think, I mean, it probably would be. I think, I can't remember the details, but I think I'm right in saying that there's a proposal as part of the NHS white paper to change the rules and the process around that. So I don't know if Robin or Debs can say a bit more about that.
Well, Debs may want to add, but yeah, just to confirm that's right, Chair. There is reference in the white paper on health and social care that came out around a month ago to pursue the potential for fluoridation to be introduced, and for that to potentially be a regional or national piece of work, rather than necessarily being something that happens in each local authority. It's a proposal. It's not yet. It's obviously going to have to go through some legal processes and some development as a policy, but it is explicit about saying it's being actively considered.
Sorry, Robin, you broke up towards the end, but I think we've got everything. Debs, do you want to add anything? Okay, I'll take some other comments on that, and then perhaps we can come back to that at the end, Stephen. Which is
I think Mike wants to come in, Councillor Swift.
Right, Mike, sorry.
No, thank you, Chair. I was just going to pick up on the comments you made about Councillor Marilyn Greenwood, who initiated some work in scrutiny on dentistry, the dentistry aspect, and that work continues under the chair of Councillor Mike Barnes, involving Councillor Lee and Councillor Evans as well. And I just want to say that NHS England at a regional level seem very keen to work with scrutiny on that. So we're hoping that work will be completed in the summer, and Councillor Barnes is keen that work is actually dedicated to Councillor Greenwood as well.
Thank you. Any other questions or comments about this? So I just wonder, Stephen, given what's said in the white paper, what the most effective route forward for this would be. I mean, I think I'm right in saying that when Paul was the Director of Public Health, I think his the annual report that he did that focused on early years did include an explicit support for fluoridization, and that was rather nuanced on the basis of being that was his report rather than the council's report, and that we should receive that as his professional advice. But I wonder if we should note that position again, note the potential changes, and say that as a health and wellbeing board, whatever the council's past position might have been, we'd be keen to explore that along with partners in West Yorkshire. Would that be a fair position to take? I think, Ashley, you'd be comfortable with that as well. So I'd certainly be comfortable with that, and just recognise there may be different political positions, but actually we should respond to what the professional advice we're getting on this is. Would you be comfortable with that, Stephen? I take it you would. Yeah.
Tim, I just popped a question in the chat box, maybe for Debs or for Julie to answer, whether there's particular worrying pockets within the population of Calderdale that we need to have some more targeted work on, or whether that's already ongoing.
Thanks. Debs, Julie, want to come back on that?
Yeah, I mean, the data, we don't have the data for small areas, but it's highly likely that all the evidence suggests that there's a strong relationship between deprivation and oral health in indicators in children. I wouldn't have thought that would be any different. I'll ask PHE if we can get some more local data, but it's based on a survey with a sample size that's it's reliable at a local authority level, but it may not be as reliable at a smaller area level. But we'll definitely look into getting that. But I think one of the reasons that fluoridation of water is so important is because it's a universal intervention, and it actually does benefit children in the most deprived areas most. So I think it's really important. And just to say, when I worked in Dudley previously, I couldn't believe how brilliant the oral health of the children in deprived areas was, and turned out that there'd been fluoridation in the water since the 1970s there. So it really does make a difference, particularly on those inequalities issues.
Yeah, it does say in the what more needs to happen box on the paper that the targeted oral health work is in the areas, the indices of multiple deprivation areas. So those are targeted for the most support. So although we can't say exactly where they are, we know where they are in Calderdale, and they are getting the targeted support they need.
Thank you. Stephen, you want to come back?
Yeah, I'd just like to confirm that actually. I was persuaded to look for to fluoridation in the water by my dentist, Andrew Atwater, who's retired now, but his practice at the time used to be on Queen's Road, and he used to say how difficult it was with children coming in who had no protection, didn't clean the teeth very well at all, if at all. And that was a really serious problem he saw day to day.
Okay, thanks very much. I'd just say Mike's reminded me that as we're a public meeting, the difficulty with using comments in the chat is that the public can't see them. Helen from Health Watch has commented, she's struggling with her IT, that dental access generally remains a significant issue for Health Watch. And that actually is probably the most significant reason why they're getting contacted by people. So that's perhaps something that it may have already happened, but the review that Mike Lodge has referred to, perhaps we can make sure that they get an update from Helen and Health Watch on that, rather than perhaps going into a lot of detail on that this morning. Neil.
Yeah, thanks. So it's just to sort of follow on from Helen's point. So I know Scrutiny's got a paper looking at access around dentistry, and the table's quite stark. 11-12 was when commissioning for dentistry services transferred to NHS England away from local commissioners, and access has been a continual difficulty in decline since then. And I think there is an opportunity in the sort of white paper, so for some NHS England commission services to come back into more local commissioning control, because I think in Calderdale we did used to pride ourselves on access for all age groups, and over the last probably decade it has declined quite considerably, hence probably the scrutiny work being done with NHS England. But there is an opportunity to look at that there and take back sort of more local control over what's commissioned, because access and the availability of NHS dentists across West Yorkshire's been quite in decline for the last decade, not just in Calderdale.
Thanks for that, Mike. And perhaps to add to that, then I think that when the scrutiny panel work's completed, we'd be interested in perhaps we were interested in seeing that here, and that might provide further evidence for that leverage around getting commissioning for dentistry back under at least ICS level under the NHS England white paper plans. Certainly I can confirm that if you want to swap away from NHS dentistry, trying to get back into it again is a nightmare at the moment. Thanks, Helen. Yeah. Okay. Any more questions or comments on that one? So perhaps the other point to add, I was looking this morning because I'd raised some questions about the sampling basis. That I note in the detail, they do say that it does say that they will look at doing more detailed local sampling as part of the survey if we think it would add value. Now, I don't know who pays for that, so that might be part of the conversation. And I suspect we probably feel we've got a reasonable indication anyway, but the next survey should be due this year. I would suspect it's probably being impacted by COVID, but it's perhaps worth at least exploring, without giving us strong guidance either way, whether you think it would be worth getting some more detailed sampling done, or whether you feel we've got sufficient evidence. We leave that with you, but it's certainly worth considering. Julie, Debs, yeah, is there anything else you want to come back on?
No, thank you. I'll take that back to the starting weld board. That's a good suggestion. Thank you.
Okay, so we'll take that back, and we'll take the point about how we can best pursue the question of fluoridation in the light of the NHS England proposals. And I know other areas in West Yorkshire, I think, would be supportive, I think, from what I've heard. Okay, thank you very much. I'm aware the next item addressing climate change was timed for 10:55. Mike, do you know if is Councillor Patient with us yet?
He isn't quite. I've just had a text message from him saying he's had an emergency, and I've asked him whether he's able to get here, but he hasn't replied yet. So I'm sort of rapidly trying to get him here or somebody else here to take the item.
Okay, well, would it be better if we swap round and take the health inequalities item first then?
The only problem with that, Chair, is I think that Sarah.
No, Chair, we've got two people coming for that.
Yeah. Okay, yeah. Right.
So
sorry, Sarah and Fatima are coming for that item.
Okay. Right. Well, the only item we've got for information is the forward plan, which I think we can cover very quickly, but let's do that just to give a couple more minutes for someone to come for the climate change item then. That's circulated. I don't know. Well, I'm aware that there's one item to add to that, which I'll mention so Mike can carry on chasing people, which is that the Place Scrutiny Panel have a group led by Councillor Kavanagh that's looking at the economic impacts on individuals and communities from COVID. They were quite keen to come and present on that here. I understand we were going to include that on this agenda, but I understand the final report isn't quite complete. So the suggestion is that we put that on the next formal agenda. If people are okay with that, I think it's quite wide ranging in terms of issues like the impacts on access to services and so on. So I think it's a good topic to pick up here. Mike, anything else to say on the forward plan, or Fazana?
Just to say, Chair, that Sharon Hobson and myself have been doing some work on a more detailed forward plan for next year, which we will be talking to the agenda setting meeting about when we next have that meeting. But I think there's actually quite a substantial programme for next year that is being developed. We also have in our diaries an informal meeting scheduled for the 1st of April, and the plan is to have a discussion about a wide-ranging discussion, not just a COVID discussion about learning disabilities at that meeting, which I think you've agreed previously. And I believe I've got a text from Councillor Patient, and he wants me to resend him the link, so I think he's trying to get here.
Okay, Thank you. Thank you. So, yes, so to confirm the informal meeting, we wanted, yes, we want to have that debate about learning difficulties. Obviously, that's one of the groups that, again, the evidence now shows were significantly impacted by COVID. But of course, there's much wider health inequality issues. We know that life expectancy for people with learning difficulties, although improving, is significantly worse than the general population. There's been some interesting discussions recently, some interesting work from the trust that we want to present on there on some of the steps that they're taking, for example. So I hope people are okay with that. If there's nothing else to come in on the forward plan, let's whilst Councillor Patience trying to get in, then let's come back to the climate emergency plan. And Debs, do you want to just start us off with that?
Yeah, if that's okay. While we wait for Councillor Patient, the paper sets out. We had a really helpful informal session of the Health and Wellbeing Board, where we looked at as a borough, we've declared a climate emergency across the system, and set a carbon reduction target. And we had a really helpful session with Health and Wellbeing Board partners to look at what the whole health and wellbeing system can do to contribute to that carbon reduction aspiration that and target that we've set ourselves. You know, there's some work going on that we're in, that again, colleagues from the Health and Wellbeing Board have been part of, and I can hand over to Councillor Patient very shortly. That's basically looking at the measures that we need to take in Calderdale if we are going to achieve that goal. So there's a number of obviously different things that would need to happen in Calderdale for us to, if we were any chance of achieving that carbon reduction goal. It's called the emissions pathway work, and that really sets that will, as we work through that process, we'll get a real sense of the action that we need to take and where the priorities for that action really need to be. This paper talks about us as a Health and Wellbeing Board declaring a climate emergency, and it also summarises some of the steps that we discussed we could take at that informal session of the Health and Wellbeing Board, and ultimately that's what the paper sort of sets out. And I'll hand over to Councillor Patient, who will who can just say a little bit more.
Thanks. Welcome, Scott.
Thank you, Debs, and thanks for covering. Sorry, I've had an awful morning with a poorly dog, so I'll attempt to pick up what hopefully has or has not been said. Thank you. Yeah, Debs made reference to the emission and reduction pathway work that's happening within Calderdale, and that's really set out the quite difficult journey we've got to get to net zero. But I think what's clear is that we need to make sure that individually and organisationally we're all making those steps. I think it's really important for anchor institutions across the board to be setting out bold steps for their decarbonisation plans that fit in with both the West Yorkshire Combined Authority's route towards net zero, as well as more broadly what we're doing in and around Calderdale. So I think what was really good in the informal session that we ran, which was really interactive and had a lot of sort of quite wide skills associated with it, and also obviously thanks to the people that put that session together. What was key was the partnership working, and the need to kind of do these things together. To hear from you guys about what steps you've taken, about what help you might need to take further steps. And clearly just how important I think organisations like the NHS, the CCG, and all of you guys are across the board to people in terms of influencing. So I guess this paper sets out what we don't want this to do is just be like one thing that we come to you and ask you about what you're doing at this point. This almost needs to be instilled into everything we do, I think, going forward. People are really keen to understand how all of our organisations are going forward. And I guess I'm just keen to hear from you what your reflections were from that meeting. if any of you have had some initial talks with each other about how we can best idea share, and what you think the next steps might be as well, really, following on from that session. I think what we want to do is make sure we keep coming back to this group, almost have the climate emergency as a standing item, I think, every time, so we can try and instill that into all of the changes we're making, from hospital configuration to how we're doing outreach in the community to green social prescribing, all across the board, really. So I'll leave it there. Sorry, I'm slightly discombobulated with personal pet matters, so I'll try and pick up as best I can, and look forward to hearing from the rest of the group.
Thanks very much, Scott. So can I open this up to comments and contributions? Scanning everywhere.
Yeah, Anna, I'm sorry, I'm chairing there when you're the chair. Apologies.
Yeah, no, it's fine. I'm for some reason I'm struggling to see people's hands. Anna, yes.
Okay, thank you very much. We very much welcome the report, and you'll know, Councillor Patient, we've arranged a separate meeting to have specific discussions around the contribution that CHFT could make towards net zero, and some of the proposals we have for changes regarding our estate around reducing embodied carbon, reducing the need for car journeys to hospital. We're really keen to discuss that with you. So I just really wanted to come in and say I'd like to really go through some of the detail of our plans with you, and welcome your input and any further ideas or anything you think that we're missing in relation to our approach to that, and our travel and plan and our green plan, which we're taking into our transformation programme board meeting on Monday.
Brilliant.
Thanks, Anna. Stephen, Dr. Cleasby.
Yeah, thanks, Tim. Yeah, similar to what Anna said, really, I guess. I mean, the commitments in there are very clear. I just wonder whether or not some of the partner organisations represented in the Health and Wellbeing Board have the level of sort of expertise to be able to take these commitments back to their own organisations, champion them, and then follow that through at officer and manager level. And of course, the CCG has been particularly focused on other crises in recent weeks and months, and we can't forget this. So I just think if there is some way of coordinating the support, officer level support, so that maybe there are individuals nominated within each organisation that can then feed back and be developed by the likes of, it's Jez, isn't it? Jez Tweed is I've got the right name, the lead manager, who's excellent, very, very well informed. And I don't know that we've got that level of expertise within the CCG, and definitely not in our 21 GP member practices. So I just think we need a bit of help to do this.
Thanks. I'll bring Deb in on that one, and then I'll come to Sue, if that's okay.
Yeah, that's really, really helpful, Stephen. And I don't know what you think, Councillor Patient, but I'm just conscious we've got our officer group. There's a where I learn an enormous amount. There's an officer group that's largely at the moment made up of officers of the council that come together and look perhaps at some of the more technical elements of the work. And I'm just wondering, Councillor Patient, if it's something we should consider, whether to offer an invitation to the officer group from a lead from each of the Health and Wellbeing Board partner organisations, because that's where I get a lot of the expertise. I don't have any expertise, but where I learn about the sort of technical elements of the things that need to happen. I don't know what you think, Councillor Patient, if that would be appropriate.
I think thanks, Deb. So, yeah, I think possibly. I think there's probably a role to be played from the council here, but I think ultimately what we want is for you guys to be going forth and multiplying within your own organisations and kind of taking that message out, if you will. I think we need to be looking here at the Health and Wellbeing Board. We need to be looking at business, small business. We need to be looking at education. I think it's important for all those different sectors to ultimately own it. But certainly, we would be happy, I think, initially to take a sort of a hand-holding role to kind of help you get there. I think there's a way to make that work. So I might be open to that as a sort of initial opening salvo to help any of your organisations that feel you need that initial input.
Perhaps just for bring, so I should also mention there's a strong focus on this work at West Yorkshire level as well, and I'm not quite sure what sort of mutual support in terms of GPs might be there, but we can pick that up further on. Can I come to Sue Lewis next?
Thanks, Chair. It's just a minor comment, but thank you for the report. My colleague Patrick Berry, who is our expert on this, so I can't speak for him, but I think he does, my understanding is he does link in to quite a lot of what's happening in Calderdale, but obviously any other development of partnerships would be great. But actually the comment was actually about our comment in the report around social housing, and it talks a little bit about a few things that Together Housing are committing to. My comment is, whilst we're the biggest provider of social housing in the borough, obviously there are other social housing providers too, and I think it's just to be conscious that it should be wider than just Together Housing, and how we work with the council to help take that across, finding out what other partners are doing and what contribution they're making as well. So it's not a criticism at all, it's just an observation about how we harness others in.
Thank you, Sue. I'll bring in a number of people, perhaps Scott, and then come back to you after those, if that's okay. Topeka?
Thank you, Chair. I think it's a really positive report, so thank you for that. As the voluntary community sector, I think there are hundreds of organisations out there, and we're just starting on this journey as part of the wider sector and making sure that we're completely on board. I think the only thing that I just wanted to raise was, again, because of the hundreds of organisations of all sizes with different levels of capacity, we don't actually have a resident expert across the sector. However, what I would really welcome is that cross-collaboration, cross-fertilisation, and making sure that as sectors we are supporting each other and enabling each other on this journey. So that would be my just my request and plea, really.
Thank you, Topeka. Tim?
Thank you. Yeah, just to reiterate, I think what others have said, just say we certainly welcome the report. I would say from an organisational perspective, it's a real live issue for us at the moment. We've got have a significant amount of time set aside at board to discuss this recently. And I think the point that's been made earlier, I think Stephen made it, around the sort of skills and experience that are available to support this sort of work is particularly important. And we found that as a board, having somebody independent of us to give us advice, guidance and support has been particularly helpful. So, and obviously we're in a position to do that, but appreciate not everybody else would be able to do so. Definitely be in touch to have the conversation about how our plans relate to what's seen here. I think they can see some really close tie-ups. But I think one of the challenges for us, and I guess for others, will be when we're working across a number of places with a number of different ambitions, we need to ensure that we've got something that speaks to the place as well as to ourselves. And I guess that's going to take a little bit of thinking and work. Final point, just to sort of reiterate, I think it was Scott made it the point at the very beginning about the importance of the sort of change, if you like, in culture around the way services are delivered and the impact that will have on this agenda. And whilst I guess one of the things we've come up against straight away is that there's a number of things that we know we could do, the number of quick wins. Some of those are sort of relatively sort of related, I guess, to estates more than anything else. But the big wins are really around culture and longer term to get into a longer term sustainable position. And I guess that from a board perspective, that will be something that we'd be probably wanting to set the tone on. And I think that would be our most helpful contribution.
Thanks very much, Tim. Councillor Evans, Ashley, can I come to you next?
Thank you, Chair. Yeah, great report, some good stuff in here. I particularly pick up on the quick wins, because I think one of the problems with this sort of thing is that we all recognise that challenging the problem is important and so on, but it's how do we do it? And so I think some of the quick wins in here are very good. I suppose my concern or desire is to make sure that some of these things happen and how they happen and how we coordinate it and whether there are funding issues with it, how we prioritise, and make sure that we do work together as individual groups and organisations and work together on this overall process and objectives. I suppose that's my real concern, is there are some very, very good things here. It's making that happen, and how do we make sure those things happen? I guess Scott, as the cabinet member responsible for this aspect, will help coordinate this and through this group that he's working with anyway. So I suppose, yes, it's all really good stuff. It's how we make it start to happen, which is important.
Thanks, Ashley. I'll come back to Scott next to respond to one there, and then some quotes myself. Thank you,
Chair. Yeah, appreciate that. Some really good comments within that, especially around the idea of that help. And I think we can give some of that help through perhaps pushing the carbon literacy that we've been doing throughout the council. That's been a really helpful sort of mechanism for getting people to understand what's needed. And I think that's definitely something we can provide that support from. I think as well, really important points from Tim about the idea of culture within this, and that's really important if we're going to change how things are done. I guess from my point of view, what certainly from the council's perspective, what really sharpened minds was the declaration of the climate emergency, and I think that really focused helping to make a real organisation and cultural shift in quite massive ways. I know Robin will back me up on that. And I think that's one of the commitments that we've listed there, is about whether this board should be declaring a climate emergency, which has all the actions attached to it in those sort of 8 commitments. And from my point of view, I think if you want to make a serious commitment to this area, which is an existential threat, let's be real, it's something that's going to stay with us long after COVID is a memory, then that for me would be one of the most significant things you can do, to own those commitments that are there, and perhaps to look at that as a working document to collaborate on, to expand on, and to make your own ultimately. I mean, that's where I'm coming from with it. I'd be interested. I can see Debs and Robin have bits to add to that.
Thanks. Perhaps before I bring Robin and Debs in, I mean, a couple of observations I'd add. I touched on the West Yorkshire work, and it's worth building on that a bit, although I'm relying on memory, so I'll probably still rely on Robin to correct me if I get this wrong, or Sarah, who's now joined us for the next item. But I mean, it is one of the 10 priorities that are identified in West Yorkshire's 5-year plan. And back in November, I spoke at the West Yorkshire Harrogate Partnership, hosted 3 days of workshops and sessions on climate change and the implications and the importance for various aspects of health and care services. And I thought that was a really important message, that they were doing that even at the time when we're coping with the pandemic. And for me, I sort of see really see some sort of interesting parallels between how we've had to react to the pandemic and the challenge of reacting to climate change, because I think, the risks of a novel pandemic was something that we'd all, a lot of us were aware of intellectually. It was on resilience plans for years. But I think there was still a huge element of shock about it actually happening. And the challenge with climate change is that it's happening gradually. There are some things you can point to as pretty dramatic things. We're not going to get a moment where everybody suddenly says, oh, look, here's climate change in the way that we did with the pandemic. And that kind of makes it challenging, I think, not just in terms of public attitudes, but kind of in terms of our own behaviours and change as well. You can always make a case, well, yes, it's really, really important, but actually something else is more important. So I thought that action by the partnership was particularly significant, that even during a pandemic, we're still saying climate change is actually, I think Rob Webster, it is as said before, actually climate change is #1 threat to the health service, not the pandemic. I think the second thing is, recognising that for health, there are some really huge issues about renewability. Yeah, I think we've touched on some of them before, that the model of care often around specialisation is actually increasing travel rather than rather than reducing it, and that's very, very challenging. But the moment you have any treatment, the amount to which hygiene depends upon disposability rather than reuse now within the NHS, which is a change from 20, 30 years ago, as I understand it, and the dependence on plastics and so on within that. There are some really enormous issues, some of which I don't understand. I gather I think there's a big issue around emissions related to inhalers as well, for example, which is obviously a hugely important part of care provision, and yet has some real downsides. So we shouldn't underestimate. This is a massive challenge for the NHS. I suppose my other question, I'm very happy both with the proposal about the board declaring a climate emergency and with us having it as a regular item. I think the challenge is, how do we make sure that's about adding value and not simply reporting on what individual organisations are doing? And it might be we want to develop that a bit more in a further report. Robin, can I come to you now?
Debs can go first, if that's all right, Chair, because I'll make some other points. But some of my points were similar to what you've just said. Debs can go first, it's fine.
Well, I was going to make the point about added value, actually, and there was something for me about the work that the ICS are doing with some expertise in Yanis and colleagues at the ICS, which is an opportunity. But there was something for me about the stuff we can do now. So recognising, and I'm definitely in this about the issues with our expertise, and it's really technical. But actually, what the paper does is says these are some of the things we can do now. All of us can do straight away, and that are pretty clear and understandable. And then the second element, which I feel is a real added value across the system, is the work that I mentioned earlier, which is around the emissions reduction pathway. And I think it's going to be really important, actually, that we bring the outcome of that to this group as one of those standing items, because what that will do is set out very practical things that we all need to do as a system, and it will help us decide what contribution each individual organisation needs to make to those issues. And they're going to be really challenging, and they are going to be really, really, really challenging. But the combined impact that the partners of this board can make to those things is phenomenal, potentially. So it feels that even though, while I take the point about the sort of issues around the expertise, I think there will be in the coming, there is in the paper some very simple and practical stuff we can all do. And I think quite soon there will be the outcome of that emissions pathway work, which will have some very clear recommendations that we can take as a system. So it was just to suggest some next steps really in relation to both of those.
Sorry, yeah, Robin, sorry.
Thank you. Yeah, thanks. And just building on what Debs has just said and what you said, Chair. So I think you're right about the challenge of this and how it compares to the pandemic. Although I'm always this reminds me of one of the last things that Debs' predecessor said to me, Paul, the Director of Public Health, who said that this pandemic is going to be one of the biggest things we've ever dealt with in our lives, but fundamentally it doesn't threaten the future of our species. Climate change does. And it will, in historical terms, always be a bigger challenge than this pandemic will ever be. There will be a solution. And obviously he said that a year ago before he knew about the vaccines. And I think his words are untrue, that it remains obviously a huge challenge, but this is a challenge which I do think it's, some would say, I'm sure Councillor Patient would add this, some would say we will reach a point where it's irreversible. So the idea that it's something that's going to come tomorrow, the tomorrow will come. And the ability that we have at the moment, I hope, and I know some even challenge this, but that we're still at a point where we can avoid that irreversible status as a species and as a world. Just moving down, so in terms of what that means, I think is that some of it's also today. So, and again, we have people who live in Calderdale who've been flooded 3 times in 8 years. We have people who are living in communities where air pollution will lower birth rate of babies that are born in those places today. that will potentially have an impact on early onset dementia or onset long-term conditions and preventable death. So, so I think just to say that, so this is a today problem, but obviously it's not a problem that we're all equally facing. And I think it's quite connected to the next item. It's quite good that health inequalities and inequalities, it has some similarities to this in terms of the impacts of this are not necessarily equally shared, but the challenges is great. And I just sort of, in terms of this, sort of what do we do about it? I think there is a level of momentum and energy about this now that's hopefully irreversible in terms of people's determination. So, and it's big and small and medium things. So it is about how we spend our collective resource. It is about the fact that the NHS contributes to 8% of all carbon emissions in the UK, 44% of public sector. Local government's not far behind on that, somewhat harder to measure for various reasons. But so we have a part to play in this, and obviously we've got a very big capital programme collectively as a place that we can influence. And just the positives about the West Yorkshire position, which I think we've covered, Chair, but just to add, it's great that Sarah's joined us, because in the sort of population health SRO role, I would just say that the energy around this from West Yorkshire is incredible. So we do some practical things. We're working to support and advise people around capital programmes. We're working to support health organisations and care organisations and how they operate. And we're also making some resource available. And we've just issued the Green Social Prescribing request. I've got to say, we're pretty deluged. I mean, I might just ask Sarah anyone to add to it. We have an incredible amount of interest in that. So just to sort of highlight that this is about our communities and our community organisations showing real energy. It's really reflecting how much capacity and social prescribing, if it's anything, is about people finding other ways to be healthy, and actually how we use primary care and some of the secondary care to enable people to be healthier. And it may be good if maybe Sarah can add a few words on that, just in terms of what we will do to sort of support this and make sure it's a commitment, if that's all right, Chair.
Thank you. Yeah, Sarah, do you want to come in on that? Well,
yes, thank you, Robin. Thanks, Chair. Yeah, to touch on the Green Social Prescribing Fund first, because I guess it's the most current. We've had 205 applications, and we were initially able to fund 12. So we're trying to seek some extra funding from different parts of the partnership. And what that's about is giving people the opportunity to kind of stay healthy and be physically active outdoors to try and improve their health with a focus on reducing health inequality. So a focus on where there isn't green space currently, and also a focus on health and care providers and increasing their opportunity for green space as well. So there's been a real interest in that from across the partnership, and that is small grant funds between £5,000 and £10,000. And we've done another couple of rounds of grant funds, one on related to inhalers that you mentioned, Chair, as well. And we've got 5 practices piloting greener use of inhalers, and that's around actually a behaviour change approach. And we've done some grant funding around active travel as well. So we've got small resources at a system level, but we're hoping what we can do is learn from that and kind of share the learning with the wider partnership. But lots of enthusiasm about it, lots of desire, I think, to learn from our sort of health colleagues. And we've also put out, there's 100 training places that anyone in the partnership can access from the Centre for Sustainable Healthcare that's on our website as well. So that might be something that colleagues want to look into as well.
Thanks very much, Sarah. Any other comments? Scott, do you want to respond to anything?
I mean, it's really good to hear Robin speak about the inequalities and the issues that are already affecting boroughs like Calderdale. I think Calderdale's typical, really, of what's happening on the sort of global scale, but writ small. I think it typifies the sort of effects the global south are having, and those inequalities and how they're reflected in public health are already here. Those people that are being flooded are the same people that have air quality issues. They're the same people that are suffering from various other stuff, from moorland burning and the fumes associated with that. So it's all in one. All of these things are being piled on top of one another. It's not a mistake that Debs is taking the lead as the Director of Public Health for the climate emergency stuff, because fundamentally it is a bigger effect on public health than it is any other sector, really. And I think we need to grab that by the horns, really, fully. And I feel like we are doing, but we can't do it alone. And I think we are looking to you guys as leaders to look at those commitments. And it's been really good to hear some of your thoughts on it and the really positive comments you have about this. And I think it's something we can continue to work together on going forward. Like I said, we can think of that as a working document and really think about how the broader partnership can input, make that work happen, and really instill those cultural changes to make, to really sort of typify what Robin spoke about, thinking about what Paul Butcher mentioned about how this is an existential threat, and it's going to cost us billions upon billions. It's going to make the cost of COVID pale into insignificance if we don't get there now. And some of it might be too late, but we can make those fundamental changes to increase people's health, to really increase and make change to public spaces that can increase people's health as well. And also think about some of the stuff that's more unquantifiable, actually, the anxieties that people in our communities have about the threat of floods, about every time it rains. They're real and they're staying and they're here when it's not flooding. So it's definitely something we need to all work on together. Thank you.
Thanks very much, and thanks for the work that's gone into this so far. I'm not seeing any other comments at the moment. So happy to approve that. If we bring back something further on how we make sure that reports have this panel add value. I think, Debs, you touched on some suggestions about that. So this will be something we want to return to and look at in our future work plan as well. Is that okay? Consensus? Thank you, everybody. And thank you very much, Scott, for coming along for that item.
Apologies for my lateness, Chair.
No, well, we were earlier than we said anyway, so it was fine. We're a little ahead of time, which is very unusual for Health and Wellbeing Board. Thank you. So item 9, tackling health inequalities. Can I welcome formally Fatima and Sarah from the West Yorkshire Partnership, and I'll let you introduce this item and also tell us what your roles are so I don't get it wrong. Thank you. So Fatima, are you starting?
Yes, I am. Thanks, Chair. Good morning, everybody. It's really lovely to be with you to be able to talk about this really important topic, which is important to me both personally and professionally. For those of you that don't know me, my name's Fatima Khan Shah. My day job, I don't know anymore, to be quite frank, but the official job title is I'm the Programme Director for Unpaid Carers and Personalised Care Programmes, but I also share the responsibility with a fabulous Sarah Smith for the delivery of the Partnership's response to the Health Inequalities Review impacting our BAME communities and staff. So we just wanted to present to you a little bit of an overview, and it is going to be a whistle-stop tour because we've been very busy on a journey that we've been on in West Yorkshire and Harrogate's Health and Care Partnership to undertake a review about the impact of health inequalities affecting our BAME staff and communities. We've got a couple of slides that I'm hoping to share. Sarah, are you all right to share them? I'm a bit doomed when it comes to Zoom.
Yes, I will try my best. I will
Well, while you're doing that, I'll just give a bit of an overview for the first slide. So this journey began actually way before COVID impacted our communities in West Yorkshire and Harrogate. It started actually in cognizance, quite rightly, of the fact that in order for us to really meet the needs of our communities and our staff, we needed to make sure that our decision-making processes reflected at all levels the people that live within our communities and work within our organisations. If we could go to the next slide, please, Sarah. So a number of pieces of work were undertaken to sort of reflect that. The first one was obviously having the Health Inequalities Network, and then the fabulous inspirational programme co-created by Robin Tuddenham and James Thomas, as well as Sarah Smith, really focusing on improving health populations, but also really cognizant of the fact that, you know, different communities have different needs and not all BAME is the same, to be quite frank. And that was a really important step to creating a really strong infrastructure within our system to be able to deliver some of the elements I'll be talking you through. In addition to that, we then started to explore some sort of feeling actually at some levels within our partnership and our organisations that there was talent within our system, but it wasn't always being fulfilled, and that there were people working within our organisations who weren't able to fulfil their potential. And we had a lot of data telling us that, from the Workforce Race Equality Standard within the NHS, the Public Sector Equality Duty within the local authority, and that all culminated in the Partnership Board, fantastically chaired by Councillor Swift, coming to the consensus of having one of our 10 ambitions reflecting our aspiration to have a much more diverse leadership reflective of the broad range of communities within West Yorkshire and Harrogate. That then obviously started to move at pace with a number of different pieces of work, which I'll talk you through very shortly. But actually, again, really reflecting the values of our partnership, the sort of element of co-production was crucial to this. So when we're talking about health inequalities, it's really important to involve the people with the lived experience, knowledge and expertise about how we're going to address those health inequalities. You can't deliver solutions to people without involving the people it impacts. That's just a bit crazy in my view. But in addition to that, if we've got a system ambition about having a more reflective leadership, then we needed to speak to the people who this impacts and co-produce with them a number of ways of how we're going to fulfill it. And I think one of the key moments when we were having that conversation in January, which was only last year, it feels like a lot longer, was a real cognizance that actually there was a lot of work to be done. There was a lot of hurt in our system, within our organisations, that there were things happening that weren't congruent to our values, and that was impacting the potential of people reaching the higher levels of our organisations, and it was having an inadvertent consequence to some of the decisions being taken, because if you haven't got everyone in the room contributing to those decisions, sometimes you inadvertently are perpetuating the inequality that you're trying to address. So as a consequence of that, we decided to launch our network of networks, really building on the sort of success of our organisational networks and place-based networks, but really amplifying the work that they were doing into the ICS and the system level forums that we've got within that. Then, unfortunately, that small thing called COVID came and started to really impact our communities in a way that we probably were anticipating to a certain degree, not to the level that we saw. And as a Pakistani woman, I still am hearing every single day of people that I am losing, of family members that I have lost, and it really is very, very real to our staff, to our communities, and we're dealing with that emotional load. And then sadly, very, very soon within that, we saw the murder of George Floyd, and I keep telling this story because I think it's so important for people to understand. But I remember still walking into my living room and my 8-year-old son watching breakfast television and watching this video of a man called George Floyd lying on the floor with a police officer's knee on his neck, and me having to explain to my 8-year-old son what was going on, and the fact that because he's slightly darker coloured than I am and he has a name that is very obviously different to others, that he will need to prepare himself for a life where, because of the colour of his skin and potentially his name, he may not be able to fulfill his potential. Now, as a mother, that's heartbreaking. And I really don't want to live in a world where that is the reality. So the fire in my belly comes from not just the vocation of my work, but because I am a mum and I want a better world for my children. I love this region and we are committed to making that change happen. And I'm very fortunate that I work alongside a number of allies, leaders like Robin Tuddenham, like James, like Rob, like Councillor Swift, like Debs, many other people who also felt the same way. And it was actually due to them and their call to action when the publication of the risk and outcomes of COVID-19 came out that this work actually started. Robin in particular was very, very keen that we didn't just look at the national information, but we did something regionally that helped us understand what this meant for us in our region, but also had a mirror held up to us about what does this mean for us as a region? What are we doing well, but also what could we be better at? And there was a real mandate of that honesty. And coming from someone with the influence that Robin has, that was crucial for the permission, quite frankly, to do this properly. We then, subsequent to that, had the brilliant opportunity of having Professor Dame Donna Kinnair lead this review. And Sarah and I will tell you, it's probably one of the most complicated and stressful pieces of work we've ever done. It was that balance, particularly between depth and pace, that was a challenge, because we wanted to do this justice. We really felt the responsibility of responding to the people in a meaningful way on this agenda and not being a tokenistic review, not another review. There's a hashtag there. But what we also wanted to do was make sure that we gave people the opportunity to speak truth to power. So that review wasn't only a meeting in a closed room, it was very open and transparent, and I'll talk you through what I mean by that. And then subsequent to that, as you can see on the timeline, there was the publication, the launch of the action plan, and a number of other things that I'm going to talk you through. Next slide, please, Sarah. I feel like Chris Whitty every time I do this. So the aim and purpose of the review was very, very simple. It was to understand the impact of the pandemic on our BAME communities and our staff. And it feels remiss of me not to talk about BAME when I say this. So we had a significant discussion about the terminology of BAME, about BAME over, and about the connotations of using one title, an acronym, to describe such a diverse group of people. We've had many conversations about this as a network of networks and I as an individual with other people. And I think what people genuinely feel is, although the acronym is not perfect, it's helpful in regards to being able to focus on the issue rather than deflecting on terms of language. So we've decided to keep it, but it's important to recognise that people do find that term upsetting at times, and that context is really important. What we also try to do is to provide context about where we are, because we're definitely not starting from scratch in West Yorkshire and Harrogate. We are, very much ahead of the game, and I might be biased because my passion and love for this region is clear. But I do think when I speak to other parts of the country that we are very much innovative and brave when it comes to the work that we do. We focused on 4 themes, which you can see on the screen, and the review took place between July and October, very much with the importance of pace, because we knew very much what the issues were, to be quite frank. What we wanted to understand was what we could do about it, and I think most people were interested in that. But just to review, summarise very quickly the areas of focus, what we also tried to do was co-produce them with the review panel members. So this wasn't something that Sarah and I cooked up in a room with Robin that we thought we wanted to focus on. It was very much co-produced with the people, lived experience, that wanted to focus on it. What was also really important and telling in that panel was that there was a real challenge from the panel members to hear from people that wouldn't normally get an opportunity to address a panel like ours. So we had real lived experience testimony from people working within our organisations, working within the grassroots of our communities, but also, more importantly, voluntary community sector organisations that have got expertise and their fingers on the pulse that wouldn't normally get a chance to contribute to something like this. And that's a real step change. And it was so powerful that they are still working with us going forward. Next slide, please, Sarah. Thank you. And I think what's really important to sort of articulate about the action plan that I'll talk you through is that we now have a vision in West Yorkshire and Harrogate, and that vision is to embed the approach to health inequalities and race inequality in the DNA of our partnership. That this is not only something that we want to embed in our system, but we want it to permeate into our places and for it to be bespoke to the needs of our places, because Calderdale has a rich and diverse heritage, but that's different to Bradford, it's different to Wakefield, and it's different to Kirklees. And we needed to make sure that in the very spirit of our partnership, that places can work autonomously and adapt things bespoke to the needs of their places, because they're the ones who know their places better than anyone. That then needs to permeate into our organisations and reach our neighbourhoods in a way that is meaningful. One of the most life-changing experiences for me, and again, another reignition of my passion for this agenda, was a lady called Sheila from Chapeltown in Leeds, who really quite heartfeltly described the fact that, she was in pain, that she'd been here before, that she'd had hope many, many times about an agenda like this, and she'd been let down over and over. And one of the key things that we committed to Sheila, and we call it now the Sheila test, it's a mantra in our system, is that we will meet that Sheila test. Sheila will feel difference in Chapeltown, in Leeds. Things will be different for her. But not only Sheila, anyone living in the grassroots of our region. The other element, which is just as important, is we have got a range of programmes working on this agenda already. Sarah's is just one fabulous example, and we needed to make sure that we encapsulate that, but also amplify what was good into the different parts of our region. So very much system, place, organisations, individuals, which is really crucial in our mantra. Next slide, please, Sarah. So again, just to talk you through what the recommendations were, and I'm mindful of the time that I've talked a lot, and I want Sarah to have the opportunity to talk you through what she's been up to. But this particular area is very, very, it's very crucial right now. It's really important that people that are working in high risk roles not only feel physically safe, but psychologically safe to come forward and tell us about how they're feeling and about issues that might help mitigate potential future risks. That was really, really important. And we've moved at pace already to address those areas, working very closely with the West Yorkshire Combined Authority. The other area, very much thinking about the Rishi Sunak changed his name, Rishi Sunak's speech yesterday on the budget about making sure that we've got equality of opportunity when it comes to economic development. We know people from BAME backgrounds are quite often on fixed term contracts, that they're quite often the first people to go in restructures. So it's really important that we mitigate and perpetuate equality when it comes to those changes that are happening and being planned for right now. So another really important element is working with the West Yorkshire Combined Authority to just something simple as equality impact assessments when decisions are being taken. And that's a really, a significant change in a short space of time. We already know about the work of risk assessments, but again, it's about amplifying the good practice and making sure people feel comfortable on both sides when having that conversation. And then the final area here, which I'm really proud of, and Councillor Swift was crucial in its implementation, particularly at Partnership Board on Tuesday, was the production of an anti-racism movement. So although it's technically a campaign in PR and comms terms, it's about really recognising the call to action that being anti-racist is not enough. Calling out racism is now something that we've all got a responsibility to do, and we've got to use our privilege to amplify that and have a zero tolerance approach. Next slide, please. And then again, really building on the solid foundation that we started in January 2020 about making sure our leadership is reflective of its community. So it's very much about how we as leaders uphold inclusive standards when it comes to, appointing people within our organisations. And we've just started at pace a process to review our recruitment and selection processes, amplifying good practice and addressing some of the fundamental issues when it comes to appointing people. And I'll just give you a quick example by what I mean. So again, using my lived experience as a Pakistani Muslim woman, I'm quite feisty. I can hold my own in a board level setting, but that is something that is counterintuitive to me culturally. As a woman, I've always been encouraged to cooperate, to not be too challenging, shall we say, and very much be modest about my achievements and what I do. So the ability to sort of self-promote, to be able to articulate what I've done, what I've delivered in an interview, is something that puts me at a significant disadvantage. And the recruitment and selection review will very much encompass elements like that. Then you've got the importance of mentorship, and we're so lucky we've got such fabulous leaders in our region. We want to amplify that and give everybody in our communities the opportunity to fulfil their potential and address some of the elements of discrimination that occur still within our system, with the opportunity to have an independent oversight within that. And then I suppose the final one is really building on some of the great work we've already started with the Bain Fellowship and really cultivating our talent of leaders in our system into our boardrooms, and really make sure that when we're talking about having representative talent, that we are reflecting that in every single forum we've got of power. I'm going to hand over to Sarah now to talk you through the rest of the recommendations.
Thank you, Fatima. And I'll just quickly introduce myself. I'm Sarah Smith. I'm a consultant in public health at West Yorkshire and Harrogate Health and Care Partnership. And I'm Programme Director for Improving Population Health, which covers a variety of things. But health inequalities is really key and fundamental to what we do, hence my involvement in this review. The couple of areas I'm going to just cover off today around the recommendations. One's around population planning. So that's about how we make the best use of resources, but particularly how we consider health inequalities there. So this was a really key element of the review, right from how we understand our local populations. So that's about how we record ethnicity in all the settings so we can actually communicate what the inequalities are in the first place. We then discussed actually how do we ensure the decisions we're making are representative of our local communities. So one of the recommendations was around having that representation that's reflective of our local population throughout the population planning or commissioning process. Another thing that came out really strongly as part of the review and as part of the panel process was that the voluntary and community sector, particularly during the pandemic, were directly providing a lot of the support to specific ethnic minority population groups who maybe weren't accessing mainstream services. So another recommendation for the review was based on the back of that, around ensuring the commissioning arrangements for those organisations are in place and are sustainable. And then the final recommendations around population planning were around actually the services themselves taking action to understand inequalities in access and actually acting on that. So ensuring that the services are culturally competent and meet the religious and social needs of people accessing the services themselves. In terms of progress at a system level, there's lots of work going on in places, but the work we've kind of managed to drive forward since the review was published in December is all our grant funding projects now, and the NHS Charities is an example of that, has a view on reducing health inequalities, and there's some specific elements in there related to reducing inequalities for ethnicity. And we've particularly pulled out some population groups that we want to focus on across West Yorkshire and Harrogate. So they include refugees and asylum seekers and gypsy and traveller populations, which again came out as really key groups as part of this review. We're also doing work as a system on vaccination uptake and really that population planning through that process. And we launched a Health Inequalities Academy, which has a real focus on reducing inequalities in general, but specifically related to ethnicity as well. And the final theme for the review was around mental health. So while we acknowledge that all health outcomes could be impacted on in relation to ethnicity, we wanted to pick one area to have a real kind of focus on, and mental health kept coming out time and time again, both by the kind of impact of the determinants of health on people's mental health during the pandemic, and also actually access to service as well. So we picked up these themes in the recommendations. So the first recommendation is around determinants of health not adversely impacting on people's mental health. So by that, we mean things like the green space, access to green space, we mean things like housing, and we mean things like education and employment. There's then a role for us to better coordinate between mental health providers and population health services. So we're doing some work around there, and actually our mental health provider collaborative have agreed to appoint a consultant in public health across West Yorkshire to take some of this work forward, which is really encouraging and shows a real commitment there. And again, going back to the support we give to the voluntary and community sector, particularly around the mental health of the people working for those organisations and how we support those to deal with sometimes the difficult stories they hear as part of their roles. So that's an overview of the recommendations. There's more of a detailed action plan in the papers, because all of those recommendations we kind of drill down into some specific actions. This is just an overview of how we're managing that process. So we're coordinating it. That's part of mine and Fatima's role. And we have a leadership fellow working with us. But actually the delivery, as Fatima alluded to, will be either through partnership programmes, other partnership organisations, but really importantly in place-based arrangements, which is why we wanted to kind of come here today and share this with you. And I know there's work going on this already in Calderdale to align the action plan for the review with local actions. Pam Bupal shared some great work with me as to where you are on that already, so that's really encouraging as well. So we just wanted to come today really to share the review, share the process really and our thought process now we've got here, share an overview of the recommendations and some of the work that's happened across the partnership today. And then just really open up to you for any questions or to consider your local actions in response to the review. So I'll stop sharing my screen now. Thank you very much, Chair.
Thank you very much, both of you, for that very thorough and passionate presentation of the work. As indicated, it's an opportunity both for questions and comments about the review, but also for individual organisations to reflect on perhaps where they are in responding to it. Clearly it's been adopted by the West Yorkshire Partnership, but it only means anything if it's reflected in what happens at place-based and local place. Robin, do you want to come in?
Yeah, just maybe just to add to the comments, just a huge thanks Fatima for your kind words, but your energy, your passion, your commitment was so strong there, and your collaboration with Sarah, who's just played such a part in lifting population health across the whole of West Yorkshire, has been pivotal. So thank you to both of you, because you've underplayed, I think, although there's a lot to say in that, about this scale of work you did in that space of time, led brilliantly by Professor Dave Donnacher here, so it was outstanding. And I think also the number of voices that we heard on the review was remarkable. So thank you to all of you. Also, just wanted to sort of note, just in case people sort of just reassure people around us taking this locally in place. Pam is on the call, I think, and just a huge thanks to Pam, who has played a part locally in supporting our work with our staff. So I think it's about how Sheila's lived experience changes, but also how our lived experience of our workforce changes and is better. And so Shax and Pam have both played a key part in making this real for us in Calderdale. And we are bringing this report with what we will do in Calderdale to the next Cabinet meeting, subject to Cabinet approval on the 29th of March. So just to sort of say that, and so that's going to bring that to life. And Pam's done a huge amount of work, already reporting some of the things we've done to empower, give opportunity and voice to our workforce as well as our community. So just we want to make that point. And I do just think the other thing was what really works for us, I think, is I think Topeka's still with us. Yeah, just the voice in the voluntary community sector was so powerful, and I think Alison was a very strong and powerful voice, as Alison always is, in a wonderful way. But we're saying that, you know, you've given us hope now. It's not just our community, you've given us hope as a sector, and just to reaffirm our commitment to this collaboration. And I recently met with Topeka and the chair of VAC, just to think about how we begin to push forward some of this work around quality, voice, and empower our sector even more. So I'm just going to say, look, we could be really helpful. Anything we pick up from today can help inform the piece of work that Pam's really ably leading into our cabinet meeting. But I think we want to give it that level of sort of some single level. Thank you.
Thank you. Topeka, you want to come in?
Thank you, Chair. I just wanted to follow on from Robin really, and really thank Pam for really getting down there and really engaging with the voluntary community sector. I think the sector has a huge role to play in connecting this work with communities. I remember way back in the late 90s when this was all in vogue, and I can really appreciate how Sheila feels, because, you know, we need to make sure that this is absolutely, a bit like the climate change, absolutely part of how we live, breathe, win hearts and minds. I think one of the key challenges and opportunities will be how we really get communities engaged in dialogue, in seeing the change. And particularly, I think there's an opportunity for young people who also face inequalities, particularly on the opportunity ladder, and how we create more opportunities for our young people. I just wanted to say, it's such an exciting piece of work. I can actually feel hope quite tangibly, and would like to spend more personal time on this. But really, again, it's making sure that we really get people to engage, and making sure that organisations like ours are absolutely playing their part. So just thank you. Thrilling piece of work.
Thanks very much, Topeka. Any other questions or comments?
Yeah, put my hand
Stephen,
up.
Sorry, Stephen.
No, thanks, Chair. Thanks,
Too
Chair,
many bits on
fine.
the screen to watch.
That's okay, no problem. I know it's not easy. So, yeah, just from a frontline practitioner's viewpoint, working in the centre of Halifax with an interest in diabetes, looking after nearly 1,350 patients, and I guess probably 2/3 of those come from Pakistani backgrounds. Many of them are poorly controlled, and spend a lot of my time, and obviously the practice nurse does as well. We're a pretty good team around looking after diabetes. We have a fairly high level of expertise around all the different treatment modalities, but we spend an awful lot of our time and energy and resource chasing up patients, working with them, telephone, video consultations, face-to-face, etc. And it's very, very difficult. It's really challenging. It's not easy. This is a great paper. I suppose my challenge is how, apart from what you've just heard there, what are we actually going to be able to do for frontline practitioners to give them the resource, the support, the training, the education to be able to really help people who are in need, who are obviously 4 or 5 times the level of risk with COVID in terms of becoming seriously ill because of poorly controlled diabetes or other long-term conditions. Obesity as well is probably one of the biggest factors in terms of morbidity around COVID. Practitioners on the front line are finding this really hard. So what can we do?
Fatima, do you want to come in on that one before I go on to Anna and Paul?
Yeah, just as a funny woman, I have a lot of views on this, as you can probably guess. So I think the first is part of the benefits of personalised care, and you know this, Dr. Cleesby, as our clinical leader. It's really important to enable people with the skills and expertise to take ownership of their own care. And to do that, we need to be culturally competent. So some of the issues we've got are things like culturally, food's a big deal. And whenever we want to show love, it's usually via food. So I have this big problem when I go and visit relatives, when I could, that they would give my children lots of sweets, like literally bagfuls of sweets. And I would say to my children, don't eat them, just keep the bag. And they would be really offended because the way in which they give love is via sugar and food. So there's something about just how we start a narrative that's culturally competent to enable people to understand some of the causations of it. And there's also something about, are we talking to the right people? So my uncle, who is also diabetic, he's not the one in the kitchen making the food, it's his wife. So in order for us to help him with his diet, someone needs a conversation with his wife who's in the kitchen making his food about what the types of foods he needs to eat, but also nagging him to go out for a walk, because she's the one, or his children will be the people that will enable him to do it. So it's just about creatively thinking about the things that we need to deliver in a culturally competent way would be my first suggestion. And the other thing that I would really say is there is something about, and we discussed this at a previous partnership board meeting, physical exercise and communities' relationships with physical exercise, which Sarah's done some fantastic work on. And I always have this conversation with a number of ladies that I see in the park when I go for my walk before I start work. And it's at 7:30 in the morning that there are many ladies and there are buyers and their hijabs doing walks around the park. And I've said to them a few times, why are you going so early? And their response was, because we don't want people to see us walking around the park. Because if we're seen around walking, people are then talking about us, asking us about what we're doing, why we're walking around, are we on our own, who did we speak to? So I think the issues aren't, as we're discussing just by those analogies, as straightforward as we think. And actually we need to be really creative about the solutions and using our anchor institution influence to have a wider conversation about our cultural perceptions and attitudes to certain things, and empowering certain communities to change the way in which they do things. I mean, they're just a couple of suggestions, but I'm mindful of the time, Chair.
Thanks, but I think they're sort of great and really interesting examples. Thank you, Fatima. Anna.
Thank you. I just wanted to say, I mean, it's highlighted the importance that this becomes a really embedded way of working, and every partner organisation is taking actions relative to the recommendations, and that then in totality as a system, as a region, it has a greater amplified impact. So I just wanted to advise that this morning, in parallel to this meeting, our Trust Board is meeting this morning, and included on our public board agenda is an update against those 4 recommendations around the specific actions that we've been taking as a trust. And just to highlight one of those actions, which I did reference when I gave the update in relation to the COVID position, is the use of ethnicity data to really understand how we prioritise our recovery plan. And, you know, historically, we've always worked on the basis around understand the clinical need and then see people in a chronological order. What we're doing now is using that live data, really good data capture, and realising that there are variations in the time some people are waiting, and that we're taking action to address that. And a particular aspect of that is, as part of our recovery plan, we are prioritising the provision of treatments for people with a learning disability, and ensuring that we provide supported treatment periods over a couple of weeks, so that people don't wait longer than they need to, having already been delayed. So I'll stop there. It's just to highlight, but as I say, that document's in our public board papers today.
Thanks, Anna. That's helpful to know. Pam, come to you next.
Thank you, Chair. I just wanted to say a couple of things, if I could. Just a thank you to Sarah and Fatima for kind of helping us through the review process. It was a journey, but a fun one and an emotional one by the end. I think for us at Calderdale, this is the first time we're bringing together the regional West Yorkshire stuff and the local stuff, and it's the time for a real honest assessment of all the stuff that we've been doing so far. Is this going to get us to where we want to get to, bearing in mind the inequalities that have been highlighted out of the pandemic? So that's the work that I'll be kind of pushing on. Also just to thank Topeka, St Augustine's and Women's Action Centre for being active members of the VCS Voices panel, bringing us that Sheila test and seeing if it's making a difference on the ground.
Thanks, Pam. I've got Tim and then Debs, if that's okay.
Thanks very much. Yeah, just a couple of quick points. Obviously, we're familiar and we've mapped us at what we're trying to do against this as an organisation, which I guess you would probably expect given our position. But what I would, I just want to make a couple of points, pick up on things that Stephen's just said. These things about practical application and how we get the message out there and the voice, if you like, into the system. I think there's two things really we can't push too much. Really, number one is the data. Really simple demonstration of what this means, not only in sort of numerical terms, but in life story terms, has been really powerful for us as an organisation, I guess, and I know others have experienced that as well. The second thing is, which I guess everybody would expect me to say, is that we can't reinforce enough the fact that, you know, the relationship between physical and mental health here. And the more that we talk about that and understand that, I think it'll be easier for us to get a grip of it across the system. But without wanting to go on into other areas, I think really big thing about storytelling and big thing about data. Those are things that are going to make the most difference, and getting people to buddy up with people if they want to understand more. And we found that again really powerful internally.
Thanks, Debs, and then Deepika.
Yeah, it was just really interesting listening to the discussion. I was just starting to think about next steps and ever the pragmatist, I guess. And just conscious that we did some work locally, as you all are aware, that the Health and Wellbeing Board adopted. So we did some work in April and May of last year. The Health and Wellbeing Board adopted an action plan based on what we heard from Black, Asian, minority ethnic communities in Calderdale. And Anna Basford has kindly agreed to lead that for us on behalf of the Health and Wellbeing Board. And one of the things that we're doing, and it was only yesterday, wasn't it, Anna, that we met with Pam and colleagues on that, is to look at that action plan, which is a system-wide action plan, and map it against the recommendations that are in this review, so that we're absolutely clear about what the Calderdale Partnership contribution to this is. There is obviously lots and lots of overlap and lots of real similarity, but the way that we're framing this now that we feel is really important is to think about now, what we need to do now, and what we are doing now actually, and what we've been doing since that engagement last year, what we need to do in terms of recovery around equality and inequalities in terms of as a system, and particularly from a Black, Asian, minority ethnic community inequalities perspective. And finally, what we need to do and to address those deep-seated structural inequalities that are what created the situation in the first place. And what I think we're really clear about is that we need to act on all of those now, but we need to recognise that the impact of those will be felt over different time scales. So I just wanted to assure the Health and Wellbeing Board that there's work underway to sort of connect the local action that's very much come from our communities in Calderdale with the fantastic work that we've just heard about at an ICS level.
Thanks, that's a useful reminder of that work. Thank you, Debs. Deepika.
I just wanted to reflect on a couple of pieces of work that we've led on. One is obviously the West Yorkshire Harrogate Partnership funded Health Inequality Fund work, which is about actually listening to unheard voices and really gathering their experiences around how inequalities affects them and how structural racism actually does affect them. I think secondly, there was a piece of work around building health partnerships, particularly working with young people, and actually how keen young people are to support some of the intergenerational work that they can actually help communities and create that cultural shift in communities. So just to kind of put it out there really, that there's really like to see some investment in terms of how we help communities connect with communities, but most importantly listen and work and co-produce some of the solutions that need to happen. But I think communities are absolutely ready to be part of this journey. So not to just think system, which I know you're not thinking system, but making sure that we're really giving opportunities to real people, young people, older people, to really engage in this and create some of the solutions working with us.
Thanks very much. I'm not seeing anybody else I think a lot of really important and valuable comments and contributions there. It seems to me, I think what I've become more aware of over the last year is the extent to which, health inequalities is not some kind of optional extra for the health and care system. They're what drives demand overwhelmingly, not just, obviously that's wider than BAME inequalities. We were talking earlier about learning difficulties, and again, we've got the same picture of some of those inequalities being highlighted and exacerbated by COVID, but also it being a stark wake-up call in terms of how intense those are. And the biggest learning that's easy to say but incredibly hard to do is that if we start off by designing a service and then saying what the inequalities implications are, we're almost setting ourselves up to fail from the start. We have to think about how our systems works for the whole population from the start, and make sure we're not taking white middle-aged male as the default. I think I can still claim to fall into that category, so I'm safe saying that. So thank you very much for the presentations and the energy that's gone into this work. I'm sure we're happy to endorse it, and I know that we've picked up on a couple of this, the way in which this is being taken through our different organisations as well. As we said, we're taking a report on this to Cabinet as well. So if people are happy to endorse that, can I?
Tim,
sorry, Stephen. Yeah.
No, there are some recommendations.
Sorry,
which might just be worth reiterating, and a point you on bullet point 3, which is about some remuneration for VCSE colleagues to continue to support the response to the review recommendations. So whether or not we can, I don't know what the mechanism would be, if we can find some, just to think about actually mapping out what resources would we need to take this work forward, because it's okay all saying this is great, but then not actually doing anything about it.
Thank you. Thanks. Good point. And Fatima, do you want to come back on that one?
Yes, thank you, Chair. It was just to assure Dr. Cleasby that we have made arrangements to remunerate the VCSE Voices members that are contributing to the review process. So I didn't want him to worry that wasn't happening or hasn't been done.
Thanks, Fatima. But I think there's a challenge in there too, though, isn't there? That endorsing that as the principle, we have similar networks at local level as well, and we do need to think about that. I know, it's an issue we've looked at going back into participation and recognising that there's a cost to people for being involved, and we need to support them in that.
Chair, just for Robin, just very briefly, I think we do need to think about that both for our VCS and also our workforce in terms of the networks that we are looking to ensure are part of how we operate as an organisation. I sent a communication to all staff earlier this week around this and the support we give to all our networks, supporting staff, and how we make sure they both have the time and the recognition to do that work, which is about exceeding and reaching their potential in their jobs. It's not an optional extra, and it's a real opportunity for them to learn, develop, and collaborate with colleagues. And also that we make sure that if there's any financial consequences of that, which I think are very modest, that we make sure that happens. But more importantly, that the cultural leadership and management support of that is recognised. So just to say that, and that will be part of the report that goes into the Cabinet at the end of March. Thank you.
Thank you. Okay, thank you. So we're happy to agree that with the recommendations. Can I see people agreeing? Thank you very much. Thank you again coming along. As we took the work plan out earlier, I think I apologise, my computer that's got the papers on slightly crashed during the meeting, so I've slightly lost where we are. But yes, I think that's covered every item on the agenda. I'm looking at Zara and Mike for confirmation. So thank you very much, everybody, for your time and contributions this morning.